So hello students and welcome back to the clinical case discussion series. We are discussing the thorax and we come to the clinical case number 7. Okay, let us begin. A CT scan is shown in which lesion is confined to a single bronchopulmonary segment. Okay, so lesion is confined to a single bronchopulmonary segment. That is what we understand. The surgeon plans a segmentectomy. So a particular part of the lung, a particular segment of the lung is to be removed. Now, define the bronchopulmonary segment. Students, I'm sure you must be knowing this. What is a bronchopulmonary segment? That's a part of the lung which is supplied by a tertiary bronchus. The part of the lung supplied by a tertiary bronchus is known as the bronchopulmonary segment. Okay. Which airway generation supplies it? So that's a tertiary bronchus. The tertiary bronchus is going to supply the bronchopulmonary segment. Can you tell me this? We've got this trachea. Trachea divides into two primary bronchus for the two lungs. Two primary bronchus for two lungs. Now, the primary bronchus will divide into secondary bronchi depending on the number of lobes, correct? So, the right primary bronchus will give three secondary bronchus. That's for the upper lobe, that's for the middle lobe, and that's for the lower lobe. The left primary bronchus will give two secondary bronchus for the upper lobe and the lower lobe. Now, this secondary bronchus will give tertiary bronchus, and the part of the lung which is supplied by one tertiary bronchus is known as the bronchopulmonary segment. So which level bronchus is going to supply that? The tertiary bronchus. Clear? Fine. Which vessel typically runs in the intersegmentally and helps to define the segmental planes? Now what runs within the bronchopulmonary segment? Let me just, how many bronchopulmonary segments are there? By the way, in the right lung, there are 10. In the left lung, there are 9 bronchopulmonary segments, 9. Okay. So now if you see a bronchopulmonary segment, we'll draw the right lung. Left lung, that's a cardiac notch, that's a lingula. Okay, quickly I'll tell you. So that's the oblique fissure, that's the horizontal fissure. So that's the upper lobe, middle lobe, lower lobe. That's the upper lobe and lower lobe. Fine. Okay, so now how many bronchopulmonary segments are for the right lung upper lobe? There are 3 bronchopulmonary segments. That's the apical, anterior, posterior. For the middle lobe, there are 2 bronchopulmonary segments. That's the medial and the lateral. For the lower lobe, there are 5 bronchopulmonary segments. That's a apical, this is anterior basal, lateral basal, posterior basal, and there's one on the medial side. That's medial basal segment. Fine. For the left lung, how many bronchopulmonary segments are there? Yes, same. This is apical, anterior, posterior. Now, this lobe is also known as the lingular lobe. So, this is the superior and inferior lingular. For the lower lobe, there are again bronchopulmonary segments: apical, anterior basal, lateral basal, posterior basal, and there is no medial basal segment. Medial basal segment is said to be absent. So 10 and 9 bronchopulmonary segments. Fine. Now, each segment has its own tertiary bronchus, has its own pulmonary artery. But what about the veins? The pulmonary veins do not belong to the bronchopulmonary segments. Okay, the pulmonary veins, they run between the segments. The pulmonary veins are intersegmental. They don't belong to one particular segment. The pulmonary veins drains more than one segment. They can drain more than one segment. So each bronchopulmonary segment has its own artery, has its own tertiary bronchus, but doesn't have its own vein. One pulmonary vein can drain many segments, and this pulmonary vein lies between the segments. This pulmonary veins are said to be intersegmental. So now if you have to resect a segment, if you have to remove a particular segment, what do we trace? We just trace the pulmonary veins. The moment you are able to trace the pulmonary veins, we are able to define a bronchopulmonary segment. So a segmentectomy becomes very easy, right? So that becomes very easy. So what is the answer here? The pulmonary veins. Why does segmentectomy preserve more lung function than lobectomy? Like lobectomy is removing a complete lobe, like upper lobe, middle lobe, lower lobe, whereas segmentectomy is removing a particular diseased bronchopulmonary segment. So if a particular diseased bronchopulmonary segment can be removed, so the amount of lung tissue that is removed would be less. Yes, so obviously It will preserve more lung tissue, right? So removing a bronchopulmonary segment will preserve more lung tissue than removing a lobe. Fine, clear students, have you understood this bronchopulmonary segment, the basis of bronchopulmonary segments, how many bronchopulmonary segments are there, what divides the segments, the pulmonary veins, okay, and a segmentectomy can be done because the diseases remain confined to a particular segment until unless the disease is so severe that it spreads throughout the segment. A very, very important clinical MCQ, clinical case presentation on the bronchopulmonary segment. Okay, there's MCQ for you students. You can answer this in the comment box. Costal pleura is innervated predominantly by, right? You can definitely answer this in the comment box, and if you have any doubts, do get back to me. Okay, thank you so much. You can follow my YouTube channel, you can follow my Insta and my Telegram channel. Okay, students, plenty of series of clinical case discussion that we have discussed about the upper limb, lower limb, thorax, and the rest of them. And see this in a sequence so everything gets covered. See this from the end to end, from the beginning to end, so that everything gets covered and you master your clinical case. Okay, thank you so much.